Police are calling in help from a hospital system proactively before mental health emergencies happen. Our Mark Salinger explains how this could help law enforcement expand co-responder programs in areas where they've not yet been available.
Each college campus is unique, but at CSU, there's something at the police department you can't find nearly anywhere else.
We're not always the best tool to solve the problem.
Jay Callahan is the chief at CSU PD. His department runs one of the only co-responder programs on a college campus in the nation. When a call involving mental health comes into 911, his officers respond alongside a clinician.
Each engagement that we have with our students doesn't necessarily have to be enforcement.
The clinicians are contracted through a partnership with UCHealth, and now that's expanding, giving more departments across the state access to mental health resources.
I would like to see the co-responder teams grow, and I know our goal here for the UCHealth team is that it possibly doubles in the next couple of years.
Jennifer Fierberg is a clinical supervisor with UCHealth, working with the co-responder team at the Aurora Police Department. At this time last year, the department was struggling to hire clinicians and hardly had enough to sustain a team. They've now responded to more than 1,300 calls so far this year.
We respond on calls all day long of people in need of resources, in need of coping skills, in need of knowing where to go when they're in crisis.
UCHealth now has clinicians at 6 police departments across Colorado. They've responded to 5,000 calls this year, giving big and small departments alike access to a mental health clinician. Manitou Springs Police only has 10 patrol officers. Now it also has a clinician.
We feel it is key to have co-responders with PD statewide to be able to respond to behavioral health calls.
From there, they connect people with services instead of just taking them to jail.
At the end of the day, this job is about service, and we're here to serve our students.
Money is, of course, always a factor in this, especially for small police departments. Chief Callahan points to a solution here by sharing resources. Police departments being open to having mental health responders for the county or even multiple counties sharing them would make them more accessible to more people, not just the ones who live in an area, Kyle, where the department can afford to pay for them. So Denver famously has the Star Van. Aurora has the Struggle Bus. They've had some real trouble getting theirs up and going. Yeah, it's supposedly what they're telling us is that it's changing, and now they have data to prove that. You take a look at what they had last year, they weren't keeping track of how many calls they were going to. They weren't keeping track of which calls to respond to. There were a lot of programs. Then UCHealth took over the contract at the beginning of the year. And now they've responded to something like 1,340 calls in the past 7 months. So it's moving in the right direction. At least now they have data to prove that as well. When they can put the numbers in front of people, that's what changes the minds. When Denver was able to put the numbers out and say this many calls, no bad incidents, that's what gets people thinking. Exactly. All right, Mark Salinger, thank you.